Hello, I'm Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. And today's topic is a little bit different, and I've titled it Thin and Constipated. See, I've pledged to give you my years of experience, and I have observed over those years some patterns, and one of the patterns I've observed is that there are some women who come to me with abdominal pelvic pain, period cramp pain, and digestive problems, and they're often constipated and often thin. And I'm going to give you some observations that I've made. I'm not a gastroenterologist, I'm not a GI specialist, but some of these observations might be relevant for you and might help you further analyze what's going on with you if this pertains to you, and might be of benefit. So I don't know whether these thin women are constipated because they're thin or they're thin because they're constipated, but they often go to the bathroom, have a bowel movement every couple of days all the way up to just a week. And when they do have a bowel movement, they have real hard formed stools. And they're not only are they thin, but they're usually petite as well, and have significant amount of discomfort that can be difficult to distinguish between uterine cramps. See, the rectum, the colon, goes right behind the uterus. So constipation pain, discomfort there can also mimic uterine cramping pain or pain from the uterus and ovaries, and the two are very difficult to distinguish. Also, if you happen to be someone who has endometriosis, the most common place for endometriosis is behind your uterus and over the colon. That's a separate video on endometriosis. So if we use, for example, birth control pills, sometimes we can reduce the contribution to this discomfort from uterine cramps, but these patients still have some discomfort, some abdominal pain, digestive problems, and often constipation. So one of the things that I wanted to go over is what's the difference between a stool softener and a laxative. So a stool softener is a pill that you can take over the counter 1 to 3 times a day, and it makes your stool absorb more fluid, and that makes it softer, and so you have less hard formed stools. And it decreases your chance of getting constipated in the first place. A laxative is to help treat constipation. It's a stimulant that encourages your bowels, your intestines, to contract and push things out. So what I'm advocating in this circumstance, why there may be a place for laxative, is starting out with a stool softener to help soften up your stools. And also, it's really of value to use a diary to keep track of your bowel movements and your eating habits, and you may discover patterns. For example, I also see these patients often skip meals, skip breakfast, sometimes skip lunch. They don't feel up to it, and then they get real hungry because they're thin. They get low blood sugar, so oftentimes they're getting their calories from soda, non-diet soda, or from liquids, juices. And that's not as, the soda especially is not nutritionally as valuable. And then they get so hungry they might binge eat a hamburger, French fries, greasy, heavier, fatty foods, meats that can cause a lot of discomfort, abdominal discomfort, poor sleep, nausea, vomiting. And the problem is that if you're low in blood sugar, when you start eating, especially if you eat like a hamburger, you don't actually get any of the sugar that gives you energy for a while. It takes a while to digest, which kind of encourages you to keep eating and overeating, and that feeling of satiety, of fullness, doesn't come till late, and that can be a problem. So you go from a cycle of not eating enough to overeating that can cause abdominal discomfort, cramping, and all kinds of problems. So taking a stool softener, watching your diet, try to eat more regular foods. Oatmeal is a good breakfast food that slowly releases glucose over time. And you want to eat fruits and vegetables, but to keep track of what you eat and when you have the symptoms. When are you constipated? The new fad right now for keeping your weight down and keeping fit is a high protein diet, but a high protein diet constipates. In fact, I believe that part of the way that helps you lose weight is that it does constipate you. It takes proteins and meats longer to go through your digestive tract and discourages you from eating as often. So if tracking your eating habits and learning to eat a more balanced diet, and I'm not going to go over all of that here. There's a vast array of information out there on healthier eating. Perhaps I'll give you a link on a good site for recommendations. But if you track your symptoms, track your constipation, your bowel movements, track the pain, track your periods, you might start seeing some patterns that will help you improve your abdominal, pelvic discomfort, improve your diet, and improve your bowel habits. And there are medicines for irritable bowel syndrome, for constipation, for diarrhea, for different problems, and there are illnesses that cause these. So if these steps don't help, that is when you want to seek your provider, your family physician, or perhaps a gastroenterologist if your family physician isn't able to sort this out for you. I hope you found this information useful. Please leave your comments. Thank you.